First, I will wash my hands and I will introduce myself to my patient. Hello, my name is Shaquila. I'm going to be interviewing you today. Do you give me consent to record this video and upload it so that my professor can view it and grade it?
Yes.
Okay. Can you tell me your full name?
Michael Daniels.
Okay. What's your date of birth?
7/12/69.
Okay. Do you know where you are? Where are we today?
We're here in the doctor's office.
Okay. What's today's date?
Today is April 11th.
Okay. And what day of the week is it?
Sunday.
Okay. What year is it?
2022.
Okay, so I just assessed my patient's level of conscious. He's A&O times 3. I assessed his speech. His speech is very fluent, and he everything appears to be intact. Do you know who the current president is?
President Biden.
Okay, do you know who the president was prior to Biden?
President Trump.
Do you know who the president was before Trump?
President Obama.
Okay, I just tested my patient's recent and remote memory and it's intact. Okay, let me ask you a question. If you were driving down the road and you saw a 1-year-old walking in the middle of the road, what would you do?
Stop.
Okay, I just test his reasoning. His reasoning is intact. Next, I'm going to start with my cranial nerves. Cranial nerve 1 is olfactory. I'm going to have you close your eyes. Close one nostril for me. And can you tell me what you smell in this cup?
Bleach.
Okay. And close the other nostril. Tell me what you smell in this one.
Rubbing alcohol.
Okay. His cranial nerve 1 is intact. Next, I'm going to do cranial nerve. You can put your finger down. Cranial nerve number 2, which is the optic nerve. I'm going to have him look at the Snellen chart. I'm going to stand back 6 feet. If I were using the wall chart, I would stand back 20 feet. Can you cover one eye and read the smallest line for me?
LTFPH.
Okay, cover the other eye.
LTFPH.
Okay, uncover your eyes. Take that. Tell me.
LTFPH.
Okay, so his eyes are 20/20, and next I'm gonna check his peripheral vision. Can you tell me when you see my fingers coming forward?
Now.
Okay, can you cover one eye? Tell me when you see my fingers.
Now.
Okay, cover the other eye. Okay.
Now.
Okay. Peripheral vision seems good. Next, I'm gonna get my fundoscope. Do my fundoscopic exam. Okay. I'm gonna do right eye to right eye with my right hand. I'm gonna find the red reflex first. I see a red reflex and I'm gonna go in from there. I see the optic disc is sharp. I see the cup. It's a 1:3 disc to cup ratio. Don't see any AV nicking or any cotton ball swab. Next, I'm gonna do the other eye. I'm gonna use my left eye to left eye. I found the red reflex. I'm gonna go in. I see the optic disc is sharp. The optic disc to cup ratio is 1:3. Don't see any AV nicking, any cotton ball swabs. Okay, next, so optic nerve 2 is intact. Next, I'm gonna do consensual and direct light, which is also up on the optic nerve 2. I'm gonna shine my pen light and check for his, see if his eyes constrict. They are at a 4 mm now. Constrict down to 3, 4 to 3. Now I'm gonna do, that was direct. Now I'm gonna do consensual. I'm gonna look in the right and look at the left eye. It constricted. Do the left and look at the right. It constricted. Okay, so that's optic nerve number 2 is intact. Next, I'm gonna do optic nerve 3, 4, and 6. I'm going to have him follow this pen with your eyes only. This is testing optic nerve 3, which is oculomotor. And optic nerve 4 is trochlear, and it goes downward and medial. And it's intact. And optic nerve 6 is abducens, and it goes lateral. So 3, 4, and 6 are intact. Next, I'll do 5, which is I did 3, 4. Yeah, 5 is trigeminal. Trigeminal nerve, I'm going to have him to try to open your jaw against resistance. Okay. And also, this is going to be sharp and this is going to be soft. I'm going to test his sensation on his forehead and on his cheek and forehead, cheek, and jaw. Is this soft? Or soft or sharp?
Soft. Soft. Sharp. Soft. Sharp. Sharp.
Okay.
Soft. Sharp.
Is it equal on both sides? Do it feel the same on both sides?
Yes.
Okay. So that is cranial nerve number 5, and it's intact. Next, I'll do cranial nerve number 7, which is facial. Can you open your eyes? Can you puff out your, okay, and can you squint your forehead? Make wrinkles in your forehead. There you go. Okay, so cranial nerve 7 is intact. Next, I'm going to do cranial nerve number 8, which is the acoustic. I'm going to do the whisper test. I'm going to stand 2 feet behind my patient, and I'm going to have you cover one ear, and I'm going to whisper a 2-syllable word.
Sunday.
Okay, cover the other ear.
Football.
Okay. Next, I'm going to do the Weber test. I'm going to activate and set it up on top of his head. Can you hear that equal on both sides?
Yes.
Okay, so that's intact. And next, I'm going to do the Ryan test. Activate my tuning fork. Tell me when you don't hear it anymore.
Now.
Can you hear it?
Yes.
Okay, I'm going to do the other side. Tell me when you don't hear it anymore.
Now.
Okay, can you still hear it?
Yes.
Okay, that test air conduction versus bone conduction. This air conduction was greater, and that's meaning that intact. Next, I'm going to do cranial nerve number 9, which is the glossopharyngeal. I'm going to have my patient to say ah. Well, I'm going to do 9 and 10. It's the glossopharyngeal and the vagus. I'm going to have my patient say ah, and I see the ovea move, and swallow for me. Okay. Cranial nerve number 9 and 10 is intact. Next, I'm going to do cranial nerve 11, which is spinal accessory. Can you show up your shoulders for me? Okay. Turn your head. Turn your head that way. Okay. That's cranial nerve 11. Spinal accessory is intact. Cranial nerve 12 is hypoglossal. I'm going to have my patient to stick your tongue out. Move it side to side. Tongue is midline. And also stick your tongue to your cheek on each side. Okay. Cranial nerve 12 is intact. Next, I'm going to have my patient, can you stand up for me? I'm going to have you walk, well, come on this side. Walk from the chair to the end of this rug for me. Just normal walking, normal walking. Okay, turn around and walk back. Can you walk back heel to toe? That's the tandem walk. And he's stable with that. Next, can you walk back on your heels? Okay, walk back on your toes. All right, now turn around this way. Can you turn this way? Hold your hands up for me. Close your eyes. Okay, I don't see a pronatal drift. Don't let me push your hands down or up. Okay, and he didn't fall over. You can sit down, have a seat. So that is good. Next, I'm gonna do the rapid alternating movements. Can you do like this for me? Really fast. Really fast. Okay. He's able, that's good. He's able to do that without any problems. Next, I'm going to do joint position. Can you close your eyes for me? Let me see your hand. Can you tell me if your finger is pointing up or down?
Up. Up.
Okay.
Down.
Okay. Let me see this hand.
Up.
Okay.
Down.
Okay, can you hold your feet up? I'm going to do your toe. Tell me if it's pointing up or down.
Up.
Okay.
Down.
Okay. The other one.
Down.
Okay.
Up.
Okay. So that is intact. Next, I'm going to do 2-point discrimination on his extremities. You're going to feel either 2 sticks or 1. Close your eyes for me and tell me if I'm sticking you with 2 or 1.
1. 1. 1. 2. 2. 2. 1.
Okay. That's intact. Next, I'm going to do stereo genius. Can you keep your eyes closed for me? Open this hand. Can you tell me, feel that, and tell me what I just put in your hand?
A key.
Okay. And the other hand, keep your eyes closed. Tell me what's in that hand.
Gym clip.
Okay. Thank you. And that was intact. Next, I'm going to do vibration sensation. I'm going to activate. You can open your eyes. Tell me if you feel this vibration. Hold your feet up for me. Can you feel that vibration?
Yes.
Okay. Let me do the other one. Can you feel the vibration?
Yes.
Okay. Next, I'm going to do his test his strength with his upper and lower extremities. Can you sit up for me? Can you hold your arms like this? And this is going to test his tricep, biceps, and deltoid. Don't let me pull, okay? Don't let me push. Okay. Now hold them out and push up and down. Okay. That's 5 out of 5 and equal on both sides. Next, I'm going to do squeeze my hands. He has equal hand grips on both sides bilaterally. Okay. Next, I'm going to spread your fingers. Don't let me pull them together. Good finger strength on both hands as well. Next, I'm going to do his lower extremities. Okay, I'm going to have you to hold your legs up. And this is testing his quads and hamstrings. Okay. And pull back. Okay. And the hip abductor, can you pull in? Push in. I'm going to put, okay, out. Okay. That's hip abduction and abduction. Next, I'm going to do his deep tendon reflexes. I'm going to have your arm up. Just hang your arm like that for me. I'm going to test his biceps and triceps. Okay. Thank you. Okay. 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 I'm going to do the patella next. Can you hang your feet some for me? There you go. Okay. Okay, now I'm going to do the Achilles. Okay. And the last one is the big. Can you hold your feet up for me? And the toes flare. And the toes flare. All right, that is the end of my neuro exam. Thank you for watching.